Singapore has reported 618 new COVID-19 infections today. It's the lowest number of daily new cases since Monday. And that takes the national tally close to 12,700 cases. In its preliminary update, the Health Ministry says the majority of the new infections are still foreign workers staying in dormitories. 7 are Singaporeans or permanent residents. The ministry will share more details tonight. Fewer coronavirus tests are being conducted in foreign worker dormitories with higher infection rates. Instead, workers who have been diagnosed with respiratory illness are deemed to have COVID-19 and are immediately isolated. An infectious diseases expert told CNA about this shift in diagnostic criteria and revealed that community isolation facilities are at a choke point as cases surge.
Migrant workers living in dormitories have been forming the majority of confirmed cases of COVID-19 infection in Singapore in recent weeks. And to believe that at this stage the situation is coming under control within that space is wrong, says infectious diseases expert Dale Fisher.
The efforts are ramping up now. It will come under control, but there's still a lot of, we're still in the very early stages of sorting this out. This is, the numbers are not really coming down. It's a function of the tests. One of the dormitories, the infection rate is, or the positivity rate of the test is so high, you get to the point where you don't need to test anymore. But just to say, if you have a clinical respiratory illness, then you almost certainly have COVID. So we put those people into isolation straight away.
Examples of such dorms include S11 and Sungai Tengah. Prof. Fisher says, for example, such cases on Friday, possibly in the hundreds, were not included in the number of new cases.
We should aim to have those clinical diagnoses eventually included in the numbers. I think that honesty is important, and that's what I believe will be the case. But there'll be a lag because it's a different reporting mechanism. Most we still want to test, but it does mean we can focus our efforts on those with less prevalence and maybe do broader sweeps where we can actually swab contacts, maybe even asymptomatic people.
He says trying to stem this spread is just one half of the equation, the other isolating positive cases.
The community isolation facilities are the choke point at the moment. One of the huge efforts at the moment is to expand the number of community isolation facilities. There's around 5,000 now. Over the next week or two, there'll be 10,000 beds. And the target is for another month or two after that to have 20,000 beds. That will ease the pressure on the hospitals, which have now got a lot of people that they would like to discharge to community isolation facilities, but they're currently at capacity.
Isolation facilities have been set up in Expo, Changi, and the government continues to seek out more space to cater to suspect cases or infected workers, and also for those who are recovering or who have fully recovered. A new site is at Tanjong Pagar Terminal, while another, according to Prof. Fisher, is being built in Tuas South. Prof. Fisher says Singapore should expect large numbers of cases to be reported in the next few weeks, but he expresses full confidence in the measures implemented. Doctors are also volunteering at the various dorms. And apart from looking after the physical well-being of migrant workers, they're also looking after their mental health.
All they need is a voice, their voice to be heard. They're beginning to understand that this is actually a milder disease because they're a younger age group.
Dr. Amin says that many Muslim migrant workers are fasting during the month of Ramadan. He's taking extra care to remind them that their health takes priority.
If you feel well, yes, you can fast. But if you need to take medicine, especially the essential medicines like antibiotic, you should take it.
When asked if he's concerned with spreading the infection amongst his own patients who are premature babies, Dr. Amin says all medical volunteers are trained to take necessary precaution so the patients will not be put at risk.
Manpower Minister Josephine Teo says the decision to suspend all construction work is a difficult trade-off. She explains that if employers were given more time to adjust, there will be a risk of wider COVID-19 transmission. Mrs. Teo's comments come in the wake of social media comments and text messages that have been circulating in recent days. These highlighted the frustrations of some employers. She says the ministry issued stay-home notices for all construction workers once infected migrant workers were linked to construction work sites. And that means migrant workers will not be allowed to step out of their dormitories for any purpose, including going to work. The measures also apply to all companies, even those that had obtained licenses earlier to operate. Now, the coronavirus pandemic has also fueled the rise in telemedicine. Smaller traditional GP chains are looking to treat and diagnose patients from a distance during this circuit breaker period. And to make the practice easier, SingPost is now equipped to deliver temperature-controlled medication island-wide.
GPs may provide an essential service and are allowed to stay open during the circuit breaker period. Some of them are trying to further limit contact between doctors and patients. UniHealth Group, which has 3 clinics, has provided teleconsultations at 2 of them since earlier this week.
With the current pandemic, we feel there's no better time to embrace it. We have also had indications from patients that they would like to see this service being offered, and some patients have very valid concerns about leaving their homes or coming to the clinic in current times.
So could you come close to the camera, okay, and shine a torch or an illumination device, okay.
Patients can book an appointment and instructions are sent over. The entire process is contactless. OneCare Medical Group plans to roll out this service next week at its 19 clinics. It will use a platform developed specially for teleconsultations. Due to privacy and security concerns, while the mode is convenient for patients, not everyone is fit to see a doctor through a camera.
You want to make sure that you're selecting the right kind of patient. The patient themselves are comfortable with the use of the teleconsult app or the video. Initial screening process is important so that we know that patients who need physical care and attention, if at any point either the doctor or the patient feels like, the quality of the consult is being compromised at that certain point in there, we have the freedom to then change it over to a physical consult.
For both GP chains, the teleconsultation extends to delivering medication through couriers. Such delivery services are gaining momentum. SingPost has been doing the same for the National University Hospital and other polyclinics since mid-February. It's recently extended this to medicines that require chilling to temperatures as low as 2 degrees Celsius.
To enable us to do that, we have invested in a cold room. We have also invested in temperature-controlled boxes, which allow us to deliver medicine island-wide within a 2 to 8 degree temperature range. From the staff front, we have also trained our staff to be able to handle this cold chain medication. And at the same time, we have also put in temperature loggers so that we can monitor the temperature of these boxes as they go around the island.
SingPost has 50 couriers trained to deliver various types of medicine to patients. They deliver to about 300 recipients island-wide every day.